This is FYI on your TV, brought to you by Hometown News. I'm Kathy Botham. I have got Suzanne Rintoul with me. You're the Executive Director of PEP, the Seniors Therapeutic Center. Welcome to FYI, our Season 8. You're our first guest.
Oh, thank you for having me. I really appreciate it.
This is great. This is great. Now let's talk a little bit. You've been here before on FYI. We've done a lot of Zooms together, but I don't know whether you've been here in the studio.
I have not been in person before, so it's really great to be here. Thank you for having me.
Welcome to the studio. So let's talk about PEP. What is PEP?
PEP is a Seniors Therapeutic Center. People come there. We have a variety of programs. We have a day program. We have a brain and body boost program. We have caregiver support groups. We have games nights for seniors. So basically, the day program is a multidisciplinary approach to care. And they come for the day, obviously. They have a chance to socialize. We do some cognitive stimulation to keep their mind sharp. We do physical exercise to keep everybody strong, but most of all, it's important that they have that, lots of fun and engagement with older adults that are the same age as them, that are also wanting to stay in their own home as long as possible.
A lot of the same interests, that sort of thing,
yeah,
too. So is that Perth and Smith Falls?
We are, yeah. So we're 10 years in Perth this year, and 5 years, we just celebrated our 5th anniversary in Smith Falls this summer.
Well, that's exciting, and I know it's popular too. It's very
yes.
well attended. And how do people get involved? Like if somebody has a family member or there's somebody that's interested in going, how do they go about that?
They just need to give us a call. We have that's usually the best way to go about it. I find the website doesn't exactly tell everything that we do for people, so it's great to be able to have a conversation with people and chat with what their needs are, what they're looking for. So they can call us at 613-201-7172. And we have some really great staff there that will be happy to have a conversation with them to find if we can meet their needs.
Excellent, excellent. Now you're here, you're going to launch a Caregiver ID program. Let's talk about that. What is the Caregiver ID program?
Caregiver ID is a program that will help to facilitate caregivers in participating in their loved ones' care. And when I say caregivers, I mean those that are unpaid caregivers, so families or friends that are helping people to basically stay home as well, right?
That's right, that's right. And they're very important, in order for people to stay at home too.
It is, yeah.
It is, yes, for sure. So, I mean, the caregiver is a badge. They're going to actually be wearing a badge. It would give them acknowledgement to other agencies, to the public, that they are there.
So this is what the badge may look something like this that they'll wear, and it will be given to them by a participating organization within Leeds, Grumble, and Lanark. They will go through a vetting process. Obviously, people will know them and people will identify them as their caregiver, and that they want them to be part of their care. It's important to them to be able to have that person to advocate for them if they want them to do that. Sometimes it's just running to pick up a prescription for someone or calling to make an appointment. It's just someone that's been identified to be included in that person's circle of care.
And I never thought of that either. We talked a little bit about this before we went on air, but it would help identify somebody who's picking up a prescription when that person isn't actually there as well.
Yeah, I mean, there's some legalities in that,
absolutely.
obviously. There's the pharmacy has their own set of rules on who can pick up what prescriptions, but certainly, if you've identified someone as being your caregiver, it opens up the conversation so that the pharmacist and you can also be part of that care team for the person that is needing you.
That's right, and there's going to be an education piece for the public as to what this is too, but in general, a lot of people have to ask the questions. It's like, who are you with this person? And
yeah, our hope is that it does help the caregivers to be more accepted, for even to people to ask the caregiver, how are you doing? Because they're often very tired. They're doing this sometimes and they have a job to go to as well, right? So it's very important that they don't feel like they are being vetted by every individual that they come across when they're taking their loved one to these appointments.
That's right, and it is so important. Like we want to take care of our caregivers so people can stay at home.
Yes.
But that's a big element in that happening is they have to take care of themselves.
Yeah.
That's right.
There's a lot of evidence shows as well that it also helps with the staff at the hospital, right, or in another care setting, because who knows that person best, right? If I was to take my mom to the hospital, I would hope that I could be there with her, or my dad could be there with her to say, you know, this is not normal behavior, or she needs to go to the bathroom, she's about to crawl over the rails. You know, it's that added safety and security. It does help to prevent medication errors as well. And it also decreases the number of hospital readmissions and return visits to the emergency department, because we have that dialogue with not just the one that's not feeling well, that can barely, you know, listen themselves, but they've got that other person there that can help to retain that information and then ensure that the instructions are followed once they're discharged.
And it's so important to have that voice.
Yeah,
and
it
that
is.
may be the caregiver. Now, how do you become a caregiver?
So
in terms of the badge program.
Yeah, so we piloted the project last year. We actually started at this time last year. It was PEP Seniors Therapeutic Center, one location of the Alzheimer's Society, as well as the Carleton Place Hospital. And we registered caregivers, and right now we're in talks with the Connect Well in Lanark, as well as CareBridge, to talk about how we can onboard caregivers within their organizations. So it will be a slow, soft launch. We want to make sure we do it right. Yeah, so I think if we can get out there and educate the healthcare professionals as well as the caregivers as to what the badge means to them, that'll be really beneficial in the spread of the program.
And that's important to notice too, because you are partnering with other associations to do this as well.
We are. So I'm a part of the Lived Experience Advisory Network for the Ontario Health Team. And we're very fortunate to have the Ontario Health Team take on the project. It will help to give the program some governance and some oversight, and as well as providing some consistency throughout the Lanark, Leeds, and Grenville County.
Okay.
Yeah.
And just another thing to note too is the caregiver may not be the POA, the power of attorney.
That's right. Yeah, they're not always the POA. Sometimes the family member that is the POA is in Toronto, right? But the next door neighbor is so good to mom or dad, right? That those are the people maybe that are the ones that would have the caregiver ID badge, that would not have to exercise that frustration, you know, when they go to take somebody and be questioned every time someone to an appointment. Yeah.
I really like the acknowledgement piece of it too. It acknowledges the caregiver, somebody that's helping somebody else. So.
And hopefully people take the time to ask the caregiver how they're doing. You know, that's really important to us. And we also plan to have resources on the back of the badge as well, where the caregivers can call the Ontario Caregiver Organization or find other resources in their area that will be helpful to them through the process, because really they're invaluable.
Absolutely.
Yeah.
It acknowledges them together too. It's like, oh, you're a caregiver, I'm a caregiver,
Yeah.
and maybe it can, you know, generate some conversation
Yeah.
and support for each other as well.
Exactly, yeah.
Now you have a seniors activity living fair coming up in October too. Let's talk about that.
Yes, we do. So the Seniors Active Living Fair is actually going to coincide with the International Day of the Older Adult, and it's sponsored by Seniors Ontario, the government, and as well as the Older Adult Association of Ontario. So we're really happy to have many community partners be a part of that event. We're going to have presentations by pharmacists, physicians, exercise presentations, and you know, there'll be not just healthcare professionals, but there'll be other people that can provide, you know, what's going on in our area that we can get involved in. We're very fortunate to have community home support. They're going to provide the snacks for us for the event, and that it's all free. We're going to have some entertainment as well, and we'll be at the Perth Legion for that on October the 1st.
So this is a lot for caregivers as well, this type of
Oh
event?
yeah,
Yes.
yeah, and we actually have a little cafe set up so that if, you know, if the person that is not the caregiver, the one they're caring for, is tired, yet the caregiver still sees that there's lots of information that they would like to view, then they're more than welcome to have a seat and just have an apple cider, a cup of tea, and just sit while their loved ones looks
Wonderful.
around to see what's available for them.
That's
Yeah.
wonderful. Well, I have to
Yeah.
give a shout out, as I always do when I talk to you, to Lila Brennan.
Oh, yes.
She goes to the PEP program, and her and I
Yeah.
are Facebook friends, and every day she comes back and she's always talking about the wonderful
Oh,
things
good.
she did at PEP
Yeah.
that day. She
Oh,
has a great
good.
time. So
Yeah, she's one of our biggest fans for sure.
absolutely, you need a reference or anything, she's your lady.
Yeah,
That's for
she
sure.
is. She even calls me to tell me when coffee's on sale at one of the stores in Perth. Yes.
That's our
Yeah.
Lila, that's
Yeah,
for sure.
she's great.
Now, how do people get a hold of you if they want any more information on the fair, on the caregiver program?
Yeah, so in order to get a hold of me regarding the fair, you would just call the PEP number, and it's 613-201-7172. And I'm not sure if we have everything regarding the caregiver ID on the Ontario Health Team website as of yet, but shortly we will. In the meantime, you're more than welcome to call us at PEP, and we can certainly refer you to the Ontario Caregiver Organization or any other organizations that are taking part in the program.
Wonderful,
Yeah.
wonderful. Well, thank you very much for joining us
Well,
today.
thanks for
Suzanne
having me.
Rintoul, Executive Director of PEP, the Seniors Therapeutic Center. Thank you very much for everything you do, and let's say hello to Lila for me.
I will do. Thank you so much.